So I have been at Amistad for the last 4 years. Before that, I did geriatric trauma. And so a lot of what I talk about and train residents and medical students about is about prevention. What you do in geriatrics, so I take care of our 65 and older population. In trauma, it was 55 and older. So a lot of patients were very offended when I walked into the room talking about geriatrics. And so I wanted to start off by talking about an emergency moment. And so as the president of the American Heart Association, some may have learned that we were selected amongst 3 areas in the country to be a national lifesaver group. And so the idea behind this is that we become better at bystander CPR. When you look at places around the country that do really, really well when it comes to cardiac mortality, it's because bystanders stepped in. A shocking statistics that always gets me, I have to reread it every time, is for every minute of time that we do not offer CPR, there's a decreased chance of survival by 10%. Wow. For every minute. And as women, we are less likely to get help. So if I have a cardiac arrest as a woman, I am less likely to have anyone do CPR on me. And so the reason for that, I think people are uncomfortable touching a woman more so than they would be a man. And so we have to be able, I think, to be comfortable, confident in learning CPR, because when we talk about statistics about the fact that that survivability doesn't exist, we are less likely to be rescued as a woman. I think what's really great about the American Heart Association is that they have recognized this and said we need to make everybody comfortable, confident in CPR. A lot of us might have learned CPR and maybe we saw it somewhere or this, and you don't feel like I'm confident enough in doing it. So we like to start off these meetings, and I encourage all of you, I hope you'll do this when you go back to work, is that every meeting you start it with an emergency moment. I think that is something, I have to give credit to my husband. Dr. Blow is a trauma surgeon, retired now, CEO of Spawn. And he came up with this idea, and I think it's a great one, is that the emergency moment, and they're doing this now all over the country, which is very cool because it came from the Coastal Bend. But before every meeting gets started, you start off by assigning who will do what if one of us had an event. And so I'd like to ask for volunteers. And so we could say who feels comfortable starting CPR. So who will be my CPR person if something happens? And if no one volunteers, perfect. Thank you. So that's our CPR person. So yeah, thank you. So if something happens, your name, please? Ida. Thank you so much. We'll do our CPR. Who can call 911 for us? Perfect. So right here in the front, could you say your name? Heather. Thank you so much. And then who can go outside and wait for the ambulance to kind of shoo them in? Thank you. In the back in the gray sweater. Do you want to say your name so we all know? Thank you. And if we had an AED machine, which I don't think we do, but if we had an AED machine or you have one in your workplace or at church, this is something great to do, because in the moment of an event, the first couple of minutes are spent kind of panicking a bit. And it takes a while to get organized. And so if you get organized before the emergency occurs, we're more likely to have success as a team. And so everywhere you go, I think you should do this at church. We're now doing it with our friends when we have get-togethers for parties. If there's an AED machine, you know where it's at. You're able to make this change. So I think that's one of the most impactful things we could do as a community. There's an app that's going to come out. It should come out in the next couple of months that it'll be announced. The Corpus Christi Fire Department has paid for, I forgot if it's Corpus, I might be giving credit to the wrong person, it might be the mayor, but someone has paid for this for us, and it's going to be an app that you can turn on your phone so that if a 911 call goes out, so let's say we put a 911 call out, then anybody who lives in the neighborhood who's CPR certified will get a message, kind of like an Amber Alert on their phone, and then they will be able to run over here and help us. And so that's a super cool thing, because if you've got an AED, you can show up to that place. So I think this is really exciting stuff that's happening in the Coastal Bend. I know I probably took 5 minutes of my 10 minutes, but I'm so excited about it, and I think it's so important. We all know the statistics. We all know that as women, including myself, terrible, terrible habits. We tend to take care of everyone else before we take care of ourselves. A lot of us have children, grandchildren. A lot of my patients, and myself included, are getting sandwiched between generations. We have our parents to take care of. We've got our kids, grandkids. There's all kinds of dynamics going on for us as women, and we get neglected. In the process, it's very easy to put ourselves, I think our natural tendencies is to be the nurturer and the caretaker, and we put ourselves back a bit. And sometimes when that happens, we're increasing our chances of mortality. And so what we need to do is take a step back. We can't help anybody else unless we help ourselves. And I think a great way is to know your numbers. So I won't ask for volunteers and Q&A in that sense, but there's a big campaign about know your numbers, and some of you might already know what that means. And so I usually, when I meet patients, I love talking to them about understanding their own individual risk factors. So each one of us, in my opinion, should walk around knowing our numbers. And so what does that mean? And so I tell each one of my patients, when you go see the specialist, I want you to know your numbers because they're going to ask you. And then we want to make sure that you're well informed about what that means. And so the first number is your blood pressure, right? And so we should all walk around knowing, what is my blood pressure? And it's not a one point in history. It's an average, so it's okay. Patients oftentimes will ask me, I just had a 148, am I having a stroke? And this, every once in a while, you'll have a little, labile blood pressure. You want to remember, try to sit down. We want to take our blood pressure. We've got to wait 5 minutes. Does your doctor's office ever do that? No, including mine. Nobody has 5 minutes to wait, let you sit down, let you be in a quiet room. Your feet need to be on the ground. Don't cross your legs. Your arm needs to be at your heart level. We do all of this wrong. Next time you guys go to your doctor's office, you're going to be like, all of this is wrong. And so, right, this is important when we take our blood pressure. And so the number one really number that you should know is your blood pressure. It is so important that the American Heart Association just recently changed the guidelines for blood pressure. And so you might find when you're going in to see your doctor, which I hope you all do, is that the top number, which I have a lot of patients that tell me, oh, my blood pressure is controlled. My blood pressure is about 140/80. And so the new guidelines show that normal is less than 120/80. And so when we start thinking in that way, and the reason for that is that as you get above 130, we know mortality goes up, right? 130, I mean, that used to be, we worried when it was 160, right? 150, we were congratulating you a bit, like things were getting better. But now we're talking about a normal blood pressure being below 120/80. So even my patients that are coming in that are 35, 40 years old thinking they're in great health, and their numbers are 126, right? Think about all the people that we know that 126, 128, we're really excited about that. That is now considered an elevated blood pressure. And so we really want to make sure we're checking our blood pressure. We want to make sure if your blood pressure is normal, continue with that yearly checkup. If you have more comorbidities, your blood pressure needs to be checked more often. If you have a diagnosis of hypertension and you're on medication, you should be checking your blood pressure every day. I always like for my patients to check their blood pressure twice a day. I love, I get very excited when my patients come in with their blood pressure readings. I don't know if all doctors are like this, but it excites me. And so the idea behind this is, are we controlling our blood pressure at all times during the day? There's two phenomenons that happen. When we go to the doctor's office, our blood pressure may be elevated because we have something called white coat hypertension. We get nervous. What is she telling me? Like, oh, my weight. I hate that we weigh everybody with every clothes item that they can bring. And I'm like, but when you're going to do your hike, they take off your shoes and your socks and everything else. And you're like, hold on, people. So, you come in nervous and anxious, and the whole process is that way. But there's also a masked hypertension that can occur where you go to your doctor's office and your blood pressure is controlled. But when you go home and in the evening time, your blood pressure is 170/100, and you're at a very, very high risk for a heart attack or stroke. So keep that in mind. I'll go through them really quickly. We've got a glucose check, right? As part of your know your numbers, you've got your high blood pressure, your glucose check, your bad cholesterol, right? That LDL. You want to know these numbers. And your fourth one is your BMI. We all have different opinions about BMI. Be within a healthy range. You know, if you're eating Whataburger when you're going home, that's what I tell my patients. Let's just try and eat healthier. I'm a big person that comes, I know, I'm a big person that believes in we're not going to be birds. We weren't meant to be little birds. And so, but I think we need to be healthier. So we need to do, especially with the advent, and I'll mention that real quick, of GLP-1s. I feel that GLP-1s have been really wonderful, and they've done a lot of great things when it comes, and that's your Ozempic and your Mounjaros and Zepbounds and everything you hear about. I think they've done a lot of really good stuff, but at the same time, they cause muscle wasting, and I feel like a lot of people miss that about these GLP-1s. So if you are on one, if you're thinking about getting on one, you need to do weight-bearing exercises. We should all be doing weight-bearing exercises as women. That means actually lifting weights. But with GLP-1s, you have to be very careful about that, because that's one of the side effects is muscle wasting. And I don't feel that we talk about that enough as a medical community. So make sure you're lifting weights. It can be small, 5 or 10 pounds. Everything we do is small. When you look at your plate, you want to fill it with vegetables, right? That's where you start eating. That's where your fork goes first. If you're like me, my fork does not like to go there. So I've got to start going there. And then you want to work your way around your plate. So always keep that in mind. It's pretty hard for a lot of us to just completely wipe out. I think some of us that do that, then we go back. So just keep trying to work on filling that plate with the vegetables. So making those small changes will make a big difference. I think I'm pretty close on time. I've got 4 minutes. I want to talk about one more thing, and then I wanted to open up for just a few questions. But I wanted to mention medical ID in case, I don't know, is everyone familiar with medical ID on your iPhone? So I will show you guys real quick. So if you go to your health app, everyone who's got your phone, of course, this is me doing trauma for a lot of years. You would get patients who would come in. And so when you go to your health app, you can set this up so that if somebody grabs my phone, I have to move my face away. And they try to put in my password, it shows this screen. So if I click on emergency, it'll show my medical ID in the bottom corner, and then it'll show my emergency contact, my blood type, medications that I'm on, my doctor, everything. Maybe my wrong weight, because it's a little but this is, to me, we should all have this. If something were to happen to us and you're trying to contact, this is a way. So it's under your health app. It's called medical ID. If you don't have an iPhone, there's apps that mimic it. You can just Google. This was transformative to us when it came out in the hospital, and I feel like we don't do a good job talking. Of course, doing trauma, blood type was so important. And so if you could put all of your medicines on here, especially for those of us that are on blood thinners or different medications that can cause an effect, this is so important to have on your phone. So I always like to mention that. I'll open it up to a little bit of questions because we have a few minutes. 10 minutes is so short. I'm sorry. Go ahead, guys. Yes, 15 minutes. Thank you. Any questions? Does anybody have? Go ahead.
You were talking about checking your blood pressure. Like,
yes.
What kind of monitor? Because I feel like the wrist one doesn't work.
Yes.
Ask me, like, what would you suggest?
This is such a good question. I love the American Heart Association website. It's called heart.org. I love it. I think it's full of very useful information on there. They have a list of blood pressure monitors. And so you can go on there, you can actually click on them and they're link activated. And so yes, they say that the wrist, all these different gadgets that they're coming out with, they're just not super accurate. And so we use sometimes, there's some people that have a real discrepancy in their bicep or they can't use the bicep one. It's better than nothing. If you use it, put it by your heart when you go to your dentist and the eye doctor, that's what they use. But if you want to use an automated one that goes on your bicep. You want to be in a quiet room, feet down, 5 minutes, bladder empty. Your bladder increases your blood pressure. So bladder needs to be empty, and then you sit there and you take it twice. So your blood pressure is really an average over 10 readings that we do is how we calculate it in the office. And so that's why I love home blood pressure monitoring, because it's really hard to do 5 minutes, empty bladder in a doctor's office and be calm, because it's not a calm environment at all. So great question. Thank you. Go ahead.
Just, all the watches.
Yes.
Resting heart rate.
Yes.
Is it accurate? Doesn't matter.
I think it is accurate, and I love the gadgets. I have a good friend of mine that's one of the local cardiologists who loves all of that. Even the EKG function can be very, very helpful. If you find anything that's abnormal, I wouldn't run to the emergency department unless you're feeling chest pain, shortness of breath, chest tightness, and you don't feel well. Usually you want to go to your doctor's office so that it can be evaluated.
What is like a normal?
Sure, normal ranges for heart rates are between 60 and 100. With that said, if you're somebody that is athletic, your resting heart rate could be normal at 48. So the heart rate in and of itself, normal range is 60 to 100. If you're asymptomatic and you've always lived at a 50, nothing to worry about. It's like blood pressure. I'll have patients that have a blood pressure of 90 over 50 and people are getting all stressed out. It's normal. There's nothing wrong with that as long as you feel okay. If you're on blood pressure medicine and your blood pressure is 90 over 50 and you find yourself feeling tired all the time, or you have a headache, or you feel weak, they've got to back off that blood pressure medicine, right? So we've got to get it to that point where we're doing more prevention and backing away medicine instead of adding something else for the fatigue, right? Hopefully that answered the question. Thank you. Any other questions, guys? We have time for one more. Thank you so much. I'm available if there's anything I can do to help. I'm always happy to come back. Geriatrics is a passion of mine, so there's all kinds of topics that we can talk about. At Amistad, I'll just mention real quick, we have a total of 6 clinics. We have 2 in Robstown, right next to each other with the Nueces County building there in Calderon. We have 2 locations in Corpus, at Brownlee, kind of by Spawn Shoreline, and the south side. We have 1 here in Aransas Pass, and we're also at the Gloria Hicks Elementary School doing counseling. I'll mention the one in Aransas Pass. We have adults. We actually have Dr. Narudin that just joined us, who's amazing. He's a retired nephrologist. If you guys don't know him, he's fantastic. We have Molly West there, who's a nurse practitioner. We also have pediatrics, Dr. Dollaby, and Jennifer Falcone, a physician. We try everywhere to have adults, pediatrics. We have counseling services. The unique thing about Amistad is that we try to have adults, pediatrics, behavioral health, with a complement of both psychiatry, which is prescribing, along with counseling. We also have FMOB and Women's Health Department, so we deliver babies out of our Corpus office on the south, Christus Font South. And then we also have a dentist. And so we really try to keep everything under one roof. We're breaking ground on a pharmacy, and our ultimate goal is to have a pharmacy at each one of our locations. So we're actively looking to have a pharmacy at Amistad and Aransas Pass. So we're very, very excited about that. And go ahead.
I do have a question.
Sure.
on the, you're building a new clinic.
Yes.
Yes, here in Aransas Pass. And I know that you've already done some work there at
Yes.
that location. So can you tell us more
Sure.
about that?
For right now, they've poured the slab. We're waiting and kind of looking at a capital campaign to build. We've had a great partnership with the owners for where we're currently at. And so for right now, just given everything that's going on in the federal government and as it applies to a federally qualified health center, Amistad is very unique that we really try to take care of everyone. And so Amistad is able, because of our model, to take care of insured. A lot of people think of a federally qualified health center as an uninsured clinic or a homeless clinic, and these things are just not the case. I think, of course, I have to brag a little bit on Amistad, but we take care, as a federally qualified health center, we take care of 1 in 9 patients around the country. And so that's a super cool thing, because I think our model really lends itself to that. So I think the building will be coming. We're just in a little bit of a pause. We'll still keep building out the Aransas Pass location because the services continue to be needed, and we're really excited to be in Aransas Pass. But as far as the actual building itself, with everything going on, we're just in a little bit of a holding pattern.
I understand.
Mhm.
Thank you.
Thank you so much for the time. Thank you. We will appreciate it. Thank you so much.